So this was a large multi-center study um, from the Cubic Consortium. So it includes 10 centers across the US with a focus on outcomes for bispecific antibodies. This is a large retrospective study where we were specifically evaluating outcomes of the patients with double hit lymphoma or high-grade B-cell lymphoma with MYC and BCL2 translocations. So we define double hit lymphoma as patients with either MYC and BCL2 or MYC, BCL2, and BCL6. So we do not include patients with just MYC and BCL6 translocations. And all in all, we had 58 patients that were included in the study. The majority received glofitamab and epcoritamab, with 3 patients receiving mosunetuzumab and pola. As far as the response rates, overall response rate was 48%, so maybe numerically a little bit lower than what we've seen overall for large cell lymphoma, and a CR rate of about 29%, so probably a little bit lower than what we see in non-double hit. Cytokine release syndrome occurred in 38%, maximum was grade 3, and neurologic toxicity occurred in 12%, max grade 4. Just 2 patients. I think the survival outcomes were probably the most important for the study. So progression-free survival at 10 months of follow-up, the median was 2.99 months, with a 1-year PFS of only 26%. So overall, patients didn't have the best survival outcomes if they had double hit disease, although compared to other treatments in this space, bispecific antibodies are probably still better than other alternatives. Interestingly, if we look at patients who achieved CR, which was about 29% of patients, the 1-year PFS was 68%. So if patients could achieve a complete response, their survival is certainly better. 1-year overall survival is 38% with median of almost 10 months. So overall, bispecific antibodies do well with double hit lymphoma, but in this setting where patients are pretty heavily pretreated, including prior CAR T in a significant percentage, the outcomes are stuck with.